Nobody teaches you this in nursing school, but it's these little hacks that make the difference between just surviving your shift and becoming the nurse every doctor trusts and every patient remembers. We all learned the Krebs cycle, but did anyone teach you how to not sound terrified when you call a surgeon at 3 a.m.? Me neither. I'm your fellow nurse survivor, and today I'm sharing 10 clinical and mental hacks that helped me go from overwhelmed to respected on the floor. These are real strategies I learned from my own mistakes and from the best nurses I know. Whether you're a new grad, finding your footing, or a burnt-out nurse needing a reset, these tips are for you. Grab your coffee, get comfortable, and let's get into it. The strongest nurses aren't just fast, they're ahead of the game. When you get your patient assignment, ask, if this patient crashes, what's most likely to go wrong? Play out the worst-case scenario in your head. For example, heart failure patient getting fluids. Think, do I have Lasix ready? Potassium low, will they need a replacement order? This mindset shift takes you from reactive to proactive. Doctors notice when you call with solutions, not just problems. That's how you become the nurse everyone wants on their team. After report, own the first 10 minutes with your patient. Use the acronym VIBES. Vitals, IV, breathing, excretion, skin. V for vitals. Don't just look at the monitor, feel their pulse, check their color. I for IV. Is it patent? Any redness or swelling? B for breathing. Listen to lungs, check oxygen delivery. E for excretion, Foley output, urine color, last BM. S for skin. Quick, check for breakdown. This scan catches problems early and sets the tone for your shift. Nothing screams newbie like a fumbled report. Use SBAR with confidence. Don't just read the chart, tell a story. Example, Dr. Smith, I'm calling about Mr. Jones in 204. His MAP dropped to 58 and urine output is 0 for 3 hours. Give your clinical assessment, not just numbers. Speak clearly and calmly. Your tone matters as much as your words. Practice your report, write it down if needed. Communicate like the clinical expert you are. Don't go on autopilot. Pair every task with critical thinking. Before giving meds, ask, why this med? What's their latest BP? What side effects should I watch for? Same for IV antibiotics? What's it treating? Any allergies? Signs of reaction? This internal dialogue turns you from a task robot into a life-saving nurse. It helps you catch errors, anticipate reactions, and educate patients. Critical thinking is your most important muscle. Use it every time. Still get anxious calling providers? Write down the essentials before you call. Jot down latest vitals, recent changes, critical labs, and what you need. Having a script keeps your call smooth and efficient. When they ask a question, you have the answer. No panic. This projects confidence and earns respect. It's a simple hack that makes a huge difference. Technology is great, but monitors lie. Always trust your gut and your own assessment over the machines. If something feels off, check on your patient before silencing alarms. Look at them. Are they talking? What's their color? Are they in distress? Your clinical assessment is more valuable than any number on a screen. The patient is the source of truth. Trust them and trust yourself. Being a strong nurse means being a fierce advocate. If something feels unsafe, speak up. Your license and your patient's life are on the line. Advocate for pain control, safe assignments, clear communication. You don't have to be rude, just clear, calm, and firm. I don't feel safe with this situation because is powerful. Protect your patients, yourself, and your profession. Your best assessment tools are your senses. Use your nose. Fruity breath, DKA, C. difficile odor. Use your eyes, ashen skin, petechiae. Use your ears, new wheeze, sudden silence. Use your touch, clammy skin, heat over a DVT. Monitors give numbers, but your senses tell the story. Pay attention, they're your most powerful tools. 3 things to always double-check. IV patency, Foley bag position, and oxygen delivery. Flush IVs before pushing meds. Never assume it's patent. Make sure Foley bags are below the bladder, not on the bed. Check oxygen is on at the right level and properly placed. These basics prevent half of all emergencies I've seen. Make them non-negotiable in your routine. Nursing is 90% routine, 10% chaos. In high-stress moments, stop and take a deep, grounding breath before entering the room. This simple pause keeps panic at bay and brings your thinking brain online. Your calm sets the tone for everyone else. Be the anchor in the storm. The thermostat, not the thermometer. That's true nursing strength. Those are 10 real-world hacks to help you become the strongest nurse on the floor. It's not about being perfect. It's about being prepared and proactive. Every expert was once a beginner. If this helped, like, share, and comment with your own nursing hacks or proud moments. Let's build each other up. This job's too hard to do alone. Thanks for watching and remember how valuable you are.